Hi, I'm Nurse Danielle from NYU Urology. You were just discharged home with a catheter. If your doctor has approved you to remove your catheter at home, here are a couple steps you can take to remove it. Before we remove, we'll just show the catheter is held in place with a small balloon that's filled with saline. This prevents the catheter from falling out of the urethra. You may notice some movement of the catheter tubing going in and out of the opening of the urethra. This is natural and normal. Just ensure that the catheter is well anchored to your thigh using either straps or the sticker that was provided for you in the hospital. The main way that we'll advise you to remove the catheter is by using a syringe to deflate the balloon with the saline and remove the catheter very easily. When you look at your catheter, there's going to be two different knobs coming out of the tube. You're going to see the one that goes into the catheter bag, and there's also going to be a port with usually some color at the end. Your color may be different than the one I have in the video. I'm going to use a syringe, an empty new syringe, going to attach it to this port, and it should start deflating the balloon on its own. If you need to, you can pull back on the syringe, just using a little bit of force. Once you pull back and you're no longer getting any fluid or air, you can disconnect the syringe, and at that point, you can easily remove the catheter. If you're having any resistance, just empty your syringe and try to pull back on the port once again and ensure that it's empty. Now, if you're at home and you do not have a syringe, we can easily also remove the catheter with a scissor. So, grabbing the same end, you're going to take the colorful piece, you can hold it up, and all you're going to need to do is cut this piece with a scissor. It's a little bit difficult to start, but once you cut it, you are going to notice some fluid leaking from the catheter piece. Just make sure you give it enough time for all of the fluid to come out, and you will notice that it's going to stop dripping at one point. Make sure you're doing this over a sink or with a towel in place. Once you notice the fluid is done leaking, slowly take the catheter out, and you're done. On the day that you remove your catheter, we usually advise you remove the catheter in the morning and make sure you are hydrating very well from before you remove the catheter and as the day goes along. If you have not urinated and you are hydrating well within about 4 to 6 hours, we advise you to either call the office or go to your nearest emergency room. You should not be feeling any significant pain from the catheter removal, but it is normal to have some burning with urination, some frequency, and some urgency after catheter removal due to irritation of the urinary tract. This usually resolves within a day or so.